Okay, we are going to go ahead and get started. Hello, everyone, and thank you for joining us for our first Reach Out and Read Wisconsin webinar of 2020. My name is Amber Bloom, and I am a project coordinator at Reach Out and Read Wisconsin. I'm here with our medical director, Dr. Dipesh Navsaria, who will be talking with you today about the key role that Reach Out and Read plays with families during the COVID-19 pandemic. I would like to go over a few housekeeping items. Let's see if I can. Before we begin, everyone is muted on the webinar just to help avoid with any sound issues. So with that, please use the chat function for any questions that you have throughout the webinar. And the chat function is located at the bottom of the Zoom screen, and it looks kind of like a conversation bubble pictured here. I will read all the questions aloud at the end of Dr. Navsaria's presentation, and this webinar is being recorded and will be shared on our website along with our past webinars. Lastly, I will be sending out an evaluation survey following the webinar, so if you can please take the time to complete that. And with that, I will turn things over to Dr. Navsaria.
Great, thank you very much. I appreciate it. Thank you all for joining me in the middle of the day on a Friday. You know, often I would say that people are trying to universally cram these things into the middle of busy work days. Of course, it's hard to know what a workday looks like anymore for many, even if you are still working in clinics or hospitals or other busy settings, or whether you're working remotely. There's still so many challenges that we're dealing with as we continue to adjust to this strange, hopefully temporary normal that's out there. I do want to say for all of you that are working in the healthcare sector, for those who support those in the healthcare sector, and really all of you, because the reality is that this entire pandemic has shown us how interrelated and interconnected all of our work is. Thank you. Thank you for finding new ways to do your work, for being able to support one another. It's really important. We know that clinics are facing many challenges right now. Certainly in my own work, in my own system, we've had massive drop-offs in the number of children being seen, just for anything, really. Many clinics have deliberately reduced their well child visits to only the most essential, or in some cases have stopped doing them entirely. Others have, chosen to go up to certain ages, primarily driven by the immunization schedule. We know that ambulatory visits have also dropped off. Some of that is intentional on the part of our clinics and health systems, in that we're trying to reduce the number of potential exposures that children may have to clinic settings and spaces. And we also know, however, that some of that is being driven by families who are frankly afraid to bring their kids in or themselves in unless they absolutely need to. So we're seeing a drop-off, but we're also seeing an uptick in telephone calls and queries and things of that nature. This is challenging, right? Because there's so much going on here that we don't know quite how to handle, and it does have very real financial implications too for clinics who may not be seeing anywhere near the patient volume that there is. I can tell you that aside from my role as the as the medical director for Reach Out and Read Wisconsin, I'm also the current president for the Wisconsin chapter of the American Academy of Pediatrics. And we, along with our colleagues nationally, are working busily away to try to help smooth some of these issues, particularly around questions of telehealth and what does or does not get reimbursed and so on. That's all kind of the technical questions of, can we do well visits remotely? Can we effectively interact with families? What's necessary? What isn't necessary? and also what other healthcare resources are going to be needed for primarily, but not exclusively, adults that may be hospitalized and needing rather extensive types of care, including ICUs and ventilators and so on. But I want to focus on something else because I actually wrote about this in my newspaper column not all that long ago, that when the COVID-19 issue began to really hit the United States, I had actually known about it for a little while because my wife is a professor of Chinese language and literature here at the University of Wisconsin in Madison. And she has, of course, many contacts in China, including in particular in Wuhan. She's been there several times, although not recently. And, so she knew exactly what was going on in pretty great detail, not just data, but also from hearing from friends and colleagues on the ground there about how things were going. And it was from her that I actually initially heard that some of the Chinese data was showing that children were not as affected by this virus anywhere in the same way that adults were. There was relatively few hospitalizations, almost no ICU care, and virtually no deaths. Certainly not zero, but virtually none. And as a pediatrician, there's that moment where you say, thank goodness. Right, there's enough things that we've seen sometimes that hit kids pretty hard, and it's good to see, right, at least one group that we are all closely involved with not getting hit so hard, and wonderful, right? We're not going to be filling up our hospitals with young children and seeing children dying or disabled, sometimes permanently from issues. But here's the thing. As I thought about it, as things started to become more front and center for us here in the United States, I realized that children actually are deeply affected by all this, that it's not issues that we'll solve with ICUs and ventilators and medication and development of a new vaccine against it and so on. These are issues that are socio-emotional, that are psychosocial. In the lightest way, we are seeing virtually all kids of all ages being affected by this need to be isolated at home with their families. In well-functioning families, that still brings some challenges. They can't see their friends so easily. Yes, online technologies and so on, but still. And for the younger kids, those online technologies just don't replace being able to see your friend at the playground or to go to their house or whatever the case may be. And I would argue that's also true of the older kids. They just don't talk about it as much. We also realize that this is not the case for all families, that being together as a family for a long period of time is necessarily a positive thing. There are families that are stressed already at best. And then you throw this on, an extra economic instability through job losses or hours being cut back, and so on. And those levels of stress can lead to home, sadly, sometimes being a scary place. We know that when families are sometimes forced together in situations like this, we see this some other mass disaster data, we see increases, sadly, in things like child abuse. We see increases in domestic violence. We see all these sorts of things take an uptick, and that's only what we know about, right? What's actually being reported. Kids don't have anywhere to go to report that someone's hitting them or being neglectful or things like that. And then, of course, there's all the mental health challenges that come with this. How many adults already suffer from depression and anxiety, and how much has that now been heightened? And they're still trying to do this job of parenting. So there's been a lot of articles, a lot of webinars, a lot of news pieces out there. There's almost too many resources now in some ways. But talking about, it feels that there's almost two polar kind of ends of what to do as a family during this time. There's the side that says, take the best advantage of this time, help your kids continue to learn and maybe learn things that the school system won't teach them. And then on the other end, you have the forget it. You know what? We're all doing the best we can. It's okay if your kids eat Fritos for breakfast and they don't learn Swedish and learn how to make sourdough at this time, you know. And the thing is, of course, we know that the answer is somewhere in between. But here's the thing. Parents are challenged. They're challenged by this. We at Reach Out and Read, we've talked so much about this whole idea of connections, of interaction, of responsive turn-taking between loving, caring adults and the children in their environment. We talk about the conversational turns, about commenting, about this idea of dialogic reading, of doing what I've often talked about as this idea of sense making of the world, that with your child going around and helping them understand what they're seeing, whether it's on TV or on a walk or things like that. That's one of the key critical roles of parenting, this job of sense making and this job of reassurance, you know, that the world is going to be okay, and that the world is a kind and gentle place that it's okay to explore and learn about and so on. But suddenly, I think all of those roles are challenged for parents, right? Is the world necessarily such a safe place when you can't go out your door and wonder if someone might infect you with a virus that leaves you unable to breathe? What do you do when this job that you might even embrace and understand of sense making, when suddenly you're now walking around and thinking, oh, I can't do this for hours upon hours a day? And I will say, as a side remark, isn't it amazing how much work our colleagues in early childhood education do to try to keep this sort of thing up over and over and over, day in and day out for such long periods of time? And our children's librarians and anyone else who works with young children, right? It's a lot, and I think we probably have a near appreciation of all that. So this is where I think we come in. The fact is that the reality that we're not able to see our families in front of us, face to face, and talk to them doesn't change the fact that they still trust us, they still rely on us, and they still, more than ever, need to hear from us that, one, they're doing okay, and two, giving them some ideas about how can I actually make sure I'm continuing to do okay, right? That they can be confident in knowing that, because kind of the ground has been pulled out from underneath them here a little bit. And some of you may remember that I've said this a few times, that there's always two questions being asked in every pediatric encounter, whether they're verbalized or not. One, how is my child doing? And two, how am I doing as a parent, right? And if we don't address that in some way, whether even if it's indirect, right, there's something missing, I think, from that encounter. So here's the thing. We can still do that. We can still do that on the other end of a screen or a telephone or whatever. We can still reach out and let parents know you're doing okay. Really, you're doing the best you can. We're all doing the best we can. And guess what? What you're trying, what you're doing is good for your child. And I believe in your ability to do it, and you can continue to do it. If you think about even the opportunity, and I will tell you, nationally, Reach Out and Read, we are actively working. It might take maybe another week and a half, 2 weeks. I'm not going to make promises. We're working on advice on how to do things like Reach Out and Read in a telemedicine type of setup. When you are trying to perhaps do some sort of well-child visit, equivalent at least, across a remote link. So we will have more concrete advice and examples and all. We are scurrying and trying to make that all happen. These things are always challenging at the best of times, and when no one can actually directly be next to each other, it's even more challenging. But we have these opportunities to ask still about what are you doing with your child? Are you sharing books together? And you know what? Even though we've always said that there's pretty reasonable data that print books are preferable to ebooks, hey, they closed the libraries, right? So suddenly it's a lot more challenging to get books, even with mail order from Amazon or whatever. And I will say, as a side note, yeah, this got deeply personal for me when they closed the libraries. While everyone else was apparently out panic buying toilet paper, I was panic placing library holds because I was afraid they would close the libraries. And indeed, I was right. 3 days later, they did. Um, Luckily, I have enough books I'm finding on my shelves now that I own that I've never actually managed to get to. That I'll be fine. But it's okay for a parent to sit down with an ebook and their child and go through that ebook for a few minutes and share what's in there and all. Because you know what? It may not be optimal, but it's certainly good enough. It certainly is. And remembering that the key in all of this, because I've seen a few people who do reach out and read. How in the world can we do reach out and read when we don't have the book to give to them physically? I would remind you that the central, most important tool in the reach out and read intervention is the skilled, caring adult, whether it's a healthcare provider or somebody else, a home visitor, a librarian, whoever the case may be, who is talking to the family and saying, you're doing a good job. It's so wonderful you're sharing books together. I like when you did this and that. And did you notice how your child did this? And I wonder if you tried this, how they might respond. That skill building, that skilled, intentional observation of what's happening and what you're hearing, we can do that remotely. It's a different dynamic. I'm not pretending it isn't the same. Even right now, it's a little strange to be staring at the little green light on my computer screen instead of people in front of me, right? But it's a different dynamic, but it's something that we can do. And it gives families a frame. It gives them a structure. It gives them a way to be able to pull all these things together and say, okay, I can do this. And I might add that this is a great time to also say, maybe at the best of times, normal times, if you suggest reading aloud to a 12-year-old, the 12-year-old might roll their eyes. The parent's like, really? I don't think that's going to happen. Who has time for that? Okay, fine. Well, suddenly, guess what? They're all together. Everyone's a little worried. This might actually be a great time to suggest reading aloud to those older kids. And maybe just trying a little bit. And they might discover that they like it. And also that it helps them pass some of that time and it rebuilds some of that connection that I think families sometimes struggle with just because of busy lives, work and school and sports and all the other activities that are out there. So I would argue that while disaster response rightly consists of finding personal protective equipment and ventilators and moving workforce around to make sure we have extra intensive care beds and the public health response of social distancing and all the stuff that goes along with that, much of our response also needs to be around the needs of children and the needs of the families around them and how we can best support them. And having, again, this concrete thing that we can say, yes, we can help you, we can offer you advice, and we can offer you a way to feel that you are being successful as a parent, even at a time like this, is one of the most valuable gifts that we can give to the families that we serve. And I think that is incredibly important for us to all think about, to embrace, and to try to push forward as much as we can at this time. So those are my thoughts about how the work that we collectively do fits in with the patients and families throughout Wisconsin and beyond that we serve. With that, I'll turn it over for any questions, comments, or thoughts that you may have.
Yes, so thank you for that, Dr. Navsaria. Just a reminder to everyone, if you jumped on late or kind of forgot the process, you can ask questions in the chat function in Zoom. So the way that you get there is kind of move your mouse and you'll see a little toolbar at the bottom of the screen. And there's a button that says chat, and I'll put something in there right now so you can kind of see. So I just sent a chat, but you can ask questions here. Just to start out, Dr. Navsaria, we did have a question from one clinic about resources of Reach Out and Read leadership or people within Reach Out and Read reading aloud to kiddos that they could share during their visits or with their families. Do you want to talk a little bit about that resource?
Mm-hmm. So the Reach Out and Read National Center does have a resource page that's actually being very frequently and actively updated. And I don't know if you want to put up that slide with resource links there. And on that page has a number of different things, including other activities provided by other organizations. There's also a link to a hashtag Read Together. It's one word. That if you look on YouTube, there's a Reach Out and Read list that has people reading aloud, reading children's books aloud, so that if you need a break and need someone else to handle the reading, that they can certainly watch that as well. And you're welcome to submit your own content of reading aloud as well there. And again, there'll be more information coming out on kind of the practicality of how to do some of this work across remote links, whether it's telephone or video or so on as well. Also on that resource page, I'll just highlight, there's all the things that we do locally at Reach Out and Read Wisconsin. And then there's the Appleton Public Library's YouTube channel. And then also just a plug for the Wisconsin AAP's COVID-19 resource page, which is also being updated virtually every single day. That's more of a practice management, health resource type thing.
Okay. So again, if anyone has questions, feel free to type them in the chat window. Another question that we did have from clinics was just about the whole process. You went into this already, but what it would look like incorporating Reach Out and Read during a telehealth visit.
Mm-hmm. Yeah, and we'll be working on some more specific advice about that, as I mentioned, including examples, because I think it's always easier when you see it being played out in front of you. Again, remember, we try not to be prescriptive about the Reach Out and Read intervention in the sense of you must ask this question this way. Instead, it's more of a flexible approach, right? The same question that you might ask when you walk into an exam room with the book in hand, and you might say, so tell me, how often do you have a chance to share books together? That sort of open-ended question can still work remotely. One thing that has been pointed out actually by our colleagues in developmental behavioral pediatrics is that there's a benefit to that you don't usually get when you are doing a video visit or something like that, in that you get to see into a family's home. We don't usually get that opportunity, right? And maybe learn a little bit about that. Or you can ask a child, can you bring me your favorite book, right? They can't do that in the clinic. They could find their favorite book out of what's in the room or available, right? But to ask them to bring their favorite book from their own bookshelf at home is actually something you can't necessarily ask in a clinic visit. So you have that opportunity as well, and you can still look and do observations for as to what you're seeing in front of you. You may need to be a little more directive depending on how the video is set up. I think we've all probably at some points been on a video conference where, the camera is completely pointed in the wrong direction, or there's like a bright window behind someone and, it's washing out everything and all. So you may have to ask a parent to move the camera a little bit so you can just see what's going on. I think we're all getting used to that over time. But I think you'll see a lot of advice and guidance around that in a number of ways. There is a comment in the chat box that if your patients are on Facebook, many public libraries still have weekly story times done by video. Library websites also provide links to online story times by staff and celebrities. Indeed, there's almost too many of those out there to even keep up with cataloging, and there's a lot of things that are going there. Dave Gerhardt, hi Dave, asks, do you have recommendations on steps that should be taken to hand out a Reach Out and Read book in a clinic face-to-face from an infection control standpoint? Should we stop passing them out? We've had a large number of patients leaving books in the room because they're afraid of the infection risk, etc. There is a one-page guidance document that was written at Reach Out and Read National Center. Okay, I'm being modest. Perry Class and I both wrote it, but it's from the Reach Out and Read National Center on the whole question of infection control. So the first thing I'll say is, if your clinic system has a specific ruling about books, okay, we cannot and should not be overruling that. Having said that, if your clinic is saying, hey, we'd like to know what you think, or if you're thinking about this in your clinic and talking to your colleagues about how we handle this. The best data we have regarding COVID-19 is that cardboard, the virus does not survive longer than 24 hours on cardboard. And if you extrapolate from that to mean all paper, it's not anywhere near as long as it is on most metal or plastic surfaces. Copper is actually an exception to that, but so if anything, the elevator button, the doorknob, the counter where they check in, et cetera, all those things are more likely to have residual viral material on it that is viable than a book would. Having said that, I could also understand a clinic saying we are no longer going to put books in communal areas like waiting rooms, and or even books that remain in the exam room, that that different kids might touch. The books that are used for the central Reach Out and Read intervention, again, should be brand new books. They're getting shipped directly, from the publisher or a warehouse, with very limited numbers of people touching it, and often no one touching it for several days while it's in a box. And remember, virus dies after a certain period of time. So as long as you're following reasonable precautions about, how you hand something to a patient, how it's being handled within the clinic, the chances of the book being a fomite, and for folks who are not familiar with that term, that is an inanimate object that might transmit disease. The chances of a book being a fomite is actually pretty low. And I think saying that or verbalizing that to a family, you say this is a brand new book and it's been handled very carefully. So, we feel very comfortable giving this to your child. Now, I'll also say this. I have seen parents come into the clinic who appear to be terrified of every surface around them. And I think if they could, would levitate into the room so that they can avoid touching anything at all. And there's probably very little that any of us can say that would dissuade them. Okay, if they leave the book behind, that's fine. I would recommend if you want to if they leave the book behind and don't want to take it, wiping down the outside quickly with a Sani wipe or other type of impregnated cloth, and then if you want to be extra careful, storing it untouched in a room for several days will remove any reasonable risk that there would be there. Again, I think their greater risk is in your doorknobs, your elevator buttons, your countertops, etc., coming in and out of the building, far more than a brand new book. So we can make sure that we send the link out to that guidance document that's that I just mentioned, in case you want to share that with colleagues or anyone else.
Thank you, Dr. Navsaria, for answering everyone's questions and just sharing with us today a little bit about your thoughts about what we can do within Reach Out and Read to help our patients and families during this time. So with that, we're going to wrap up the webinar. Just a reminder to everyone, I will be sending out an email with an evaluation survey, and at that time you can ask any additional questions that you may have. I'm also going to send out a resource document with some of these things that we talked about for resources, along with what we were just talking about, the guidance about books. So yeah, thank you, Dr. Navsaria. Thank you, everyone, for joining today. And that's all I have for you.
Well, and I'll just say one more thing. Thank you very much to all of you. We know this is hard for everyone in their work. We see you. We know it's there. We appreciate you, whether you're working remotely or right on the front lines. And thank you. It is really a service to our entire society for all the efforts that you're putting in. So thank you, and keep up the good work.